Hi, everyone. This is Professor Kennedy Edem-Kukia. Today, we want to continue with our earlier discussion that we started on drug absorption. Earlier, we mentioned that when we talk about drug absorption, we are basically referring to the process by which drug molecules move from the site where they are administered into circulation. And we said that this is a very important pharmacokinetic process in that it allows us to be able to determine how quickly our drugs work. It also ensures that we can know how long the drug works and then the intensity with which the drug would work. Now, today we want to continue the part 2 of what we did. And we would like to have some understanding of the factors that influence drug absorption. And some of the factors, these are not all, but some of the factors that influence drug absorption, we have physicochemical properties of the drug, we have route of administration, the pH of the medium, the blood flow to the site of absorption, available surface area, the contact time at the site of absorption, the presence of food in the GIT, that is the gastrointestinal tract, disease states, and then the presence of other drugs. And so what we are going to do subsequently would be to pick each of these factors and illustrate how they influence drug absorption. And so quickly, I'm going to pick each of them and then do some illustration. And I hope that this is going to be very interesting and simple enough for all of us. So our first illustration would be on the physicochemical properties of the drug. We are saying that this is one of the factors that can determine whether our drug will be well absorbed or it will be slowly or not well absorbed. Now, anytime you talk about physicochemical properties, our interest is in the physical and then the chemical properties of the drug. And so what are some of the physical properties? What are some of the chemical properties that can affect the drug? Drugs are usually chemicals and they have a physical state. And so the drug could be solid, it could be liquid, it could be gaseous. And the states in which these drugs are could influence how they get absorbed, right? How they get absorbed. And some of these properties, we could think of the size of the drug molecule. We think of the charge on the drug molecule, whether it is positively charged or negatively charged. We could also look at whether it is lipophilic. So lipophilicity is another factor to consider. We may also look at whether the drug is hydrophilic. So hydrophilicity or hydrophobicity, whether it is hydrophobic. We may then consider whether the drug is a weak acid or a weak base. Now, these properties, these inherent properties in the drugs are important because they could determine whether the drug is going to be absorbed quickly or not. So let's pick maybe a cell membrane which is semi-permeable. And let's say that our drug molecules are here. Okay. And this drug molecule needs to move across this membrane to this other side, which is circulation. Now, depending on the size, the drug molecule would be able to cross this membrane without any trouble, and it may cross passively. But if the size is too huge, then it will be difficult for the drug to be able to cross because the membrane will not be able to allow it. Remember, we said that it is semi-permeable. And so there are size ranges that allow drug molecules to be able to easily cross membranes when they are getting absorbed. But when the size is above the range that we are saying is normal, then the drug's absorption would be impaired. So there are certain drugs that if you, for instance, give them orally, it will be difficult for them to be absorbed because their size is so huge that they cannot cross membranes. An example is heparin, which we use as an anticoagulant. We could also think of vancomycin. We may also think of aminoglycosides. An example of aminoglycoside is gentamicin. So these drugs, the sizes are very huge. So it is difficult for them to cross the cell barriers to be able to enter into circulation. So normally we give them as injections instead of giving them orally. But if your intention is that probably you want the drug to work locally, maybe in the GIT, then probably you could decide to give it, that's for not for heparin, but let's say vancomycin. If you give it orally, then the idea is that you are trying to achieve a localized effect. Now, what about charge? So let me quickly clean this and we'll talk about the charge. So when it comes to the charge of the drug, as I mentioned earlier, a drug may either be positively charged, in which case it is a cation, or it may be negatively charged, in which case it is an anion. And this is normally related to whether the drug is weakly acidic or weakly basic. So usually weakly acidic drugs in solution would be anions, and then the basic drugs will be cations. All right. So if the drug has charges, let's say this is your membrane, your drug molecules, some are without charges. This one has a positive charge. This one has a negative charge. It is easier for drug molecules that are not charged to be able to cross into circulation. They can easily cross the cell membrane and enter into circulation. It is difficult or more difficult for those that are charged, that is the positively charged ones and the negatively charged ones, to cross. Now, it does not mean it is impossible, but it is difficult. So assuming I have these three kinds of drugs, I would expect that I would have more of the neutral ones crossing, all things being equal. If their size is okay, then I'll have less of the charged ones crossing. So a drug that is charged would not be absorbed as well as a drug that is not charged. So that is how charge affects absorption. We come to lipophilicity. Now, when we talk about lipophilicity, we need to consider whether the drug is one that could easily dissolve in lipid medium, okay? Or the lay person will say a fatty medium, all right? Now, if the drug is lipophilic, because the cell membrane itself is also lipophilic, it has the phospholipid bilayer. If the drug is lipophilic, it should be able to cross this barrier easily to enter into circulation. But there's a caveat here. There's a caution here. We want the drug to be lipophilic, but at the same time, we have to be careful that it is not extremely lipophilic. Otherwise, if it is extremely lipophilic, it may end up being trapped in this membrane instead of getting into circulation. And so the drug needs to be lipophilic, but to an extent that ensures that it can easily partition across the membrane into the circulation so that it can be carried from circulation to wherever the drug needs to be. Now, when we talk about hydrophilicity or hydrophobicity, here we are dealing with hydro means water, philicity means it's love for something. So if we say the drug is hydrophilic, it means that it loves polar medium or a medium that has water. If we say hydrophobic, then it means that it hates or it does not like to associate with mediums that are or polar, mediums that are polar. So a drug that is hydrophilic may find it more difficult to cross the cell membrane as compared to one that is hydrophobic. So always keep that in mind. The hydrophobic ones will cross easily, so they are absorbed better as compared to the hydrophilic drugs. You pick a drug like aminoglycosides. They are normally described as very hydrophilic agents. Now, because they are hydrophilic, it makes it difficult for them to cross cell membranes. But if you have another drug like probably chloramphenicol, this is not too hydrophilic. And so as compared to, let's say, aminoglycosides, it should be able to cross the cell membrane easily. So that means that compared to chloramphenicol, gentamicin will not be absorbed, or not much would be absorbed, but then the chloramphenicol would be absorbed better. When we pick weak acid or weak bases, whether the drugs are weak acids or weak bases, remember, not all drugs may be weak acids or weak bases, but some drugs, or quite a number of the drugs we give, are weak bases or weak acids. And if they are weak bases or acids, the states in which they would be in order for them to